Family medicine contributes to better care for patients because this field is really built on the idea of trust, long-term relationships, long-term goals. You are meant to get to know your patient, and just by virtue of knowing someone, you automatically care for them more, both in a medical sense and in a personal sense. Patients benefit from an all-over approach to their health. They come in with their own ideas about health, about their life, about what their day-to-day priorities should be. We work with them to agree on priorities, agree on long-term goals, and find ways of managing their illnesses and finding ways that our treatments can fit into their day-to-day routine. Family history is almost a requirement for integrative care for a patient. Patient comes into me, I want to know, are your grandparents alive? Are there any major illnesses in the family? That's going to help me figure out what screening tests they'll most benefit from. That will also help me decide where to spend most of our time. Family medicine helps treat chronic conditions by way of building the field around chronic conditions. You're supposed to have a long-term relationship with your family doctor. They are going to be most concerned with the things that they can prevent now and that they can treat in the long run. They want to know about your blood pressure, about your cholesterol. They will work with you to find ways of managing these things in your day-to-day life. Our job during any given encounter is to figure out what needs to be taken care of today, what can we prevent for the future, and how can we agree on when and where these goals should be met. That includes things like tobacco use, that includes things like weight loss. These things don't change overnight. And by coming to your family doctor, you really find a partner for figuring these things out. And I speak plainly to my patients about that. Here are my priorities. This is what I hear are your priorities. What can we get done in this visit today? What's most important to us as a team? Family medicine helps to reduce the cost of medical care by aiming to prevent things now before they become bigger problems later. I chose family medicine because it really is the backbone of a healthy medical system. There are things that I can do for them that often surprise my patients. Women's health, children's well visits, these are not just things that you need to go and see a specialist for. I can handle that in my office. Following a family often looks like this. If you're lucky enough, the patient comes in while she's still pregnant. Oftentimes, she'll come in for the newborn checkup, maybe in a week or two since delivery. At that visit, my goals are going to be finding out about how baby's eating, diapers, sleep, basically the things that have consumed this newborn for the past week. My other goals include asking the parents how they're doing. How are they sleeping? How are they eating? It's not just a visit by one person at that point. You're looking at a family unit.